Psychological factors can play a significant role in the development and exacerbation of various health conditions. Here are 25 psychological causes or contributors to health diseases. Chronic stress. Prolonged exposure to stress can lead to an overactive stress response, contributing to conditions like hypertension, cardiovascular disease, and weakened immune function. Anxiety and depression. Mental health conditions such as anxiety and depression are linked to an increased risk of heart disease, diabetes, and other chronic illnesses. Maladaptive coping strategies. Engaging in unhealthy coping mechanisms, such as excessive alcohol consumption, smoking, or overeating, can contribute to various health issues. Emotional suppression. Not expressing or processing emotions effectively can lead to psychological distress and potential physical manifestations of stress. Chronic anger and hostility. Unresolved anger and chronic hostility have been associated with higher rates of cardiovascular diseases and hypertension. Perfectionism. Excessive perfectionism can lead to chronic stress and may contribute to conditions like anxiety, depression, and eating disorders. Sleep disorders. Sleep disturbances, including insomnia and sleep apnea, can worsen physical health conditions, impair immune function, and increase the risk of cardiovascular diseases. Psychosomatic disorders. Psychological factors can exacerbate or contribute to conditions like irritable bowel syndrome, tension headaches, and other psychosomatic illnesses. Post-traumatic stress. Traumatic experiences can lead to post-traumatic stress disorder, PTSD, which may be associated with various health issues, including cardiovascular problems and immune system dysregulation. Low self-esteem. Poor self-esteem and a negative self-image can impact behaviors and lifestyle choices, potentially leading to health issues like substance abuse, eating disorders, and inadequate self-care. Social isolation. Loneliness and social isolation have been linked to a higher risk of cardiovascular diseases, weakened immune function, and mental health issues. Childhood adversity. Traumatic experiences during childhood, such as abuse, neglect, or adverse family environments, can have lasting effects on physical and mental health in adulthood. Unhealthy body image. Negative body image and body dissatisfaction can contribute to disordered eating patterns, depression, and anxiety. Chronic anxiety and worry. Persistent worrying and anxiety can lead to chronic activation of the body's stress response, potentially impacting the cardiovascular and immune systems. Type A personality. Individuals with a Type A personality, characterized by competitiveness, impatience, and high levels of stress, may be more prone to cardiovascular diseases. Coping with grief and loss. Unresolved grief and loss can lead to emotional distress and, in some cases, contribute to physical health issues. Learned helplessness. Feeling powerless and having a lack of control over one's life can negatively affect mental health and exacerbate physical health conditions. Lack of emotional regulation. Difficulty regulating emotions can lead to heightened stress responses and increased vulnerability to health problems. Substance abuse. Substance abuse, including alcohol and drug misuse, can have severe physical and mental health consequences. Adherence to unhealthy behaviors. Psychological factors can influence an individual's willingness to engage in unhealthy behaviors, such as poor diet, lack of exercise, and inadequate sleep. Chronic grief and bereavement. Prolonged or complicated grief can have implications for both mental health and physical well-being. Negative self-talk. Frequent negative self-talk and self-criticism can contribute to feelings of worthlessness and impact overall mental and physical health. Lack of resilience. Low resilience can make individuals more susceptible to stress-related health issues and difficulties in coping with life's challenges. Workaholism. An excessive focus on work to the detriment of personal life can lead to burnout, increased stress, and health problems. Childhood emotional neglect. A lack of emotional support and validation during childhood can contribute to emotional difficulties and mental health issues later in life.